Okay, so we're going to see just the glucometry skill station. This is for our practical exam. So I'm going to show a quick video. I'm going to pause, talk about a few things, but make sure everyone understands what we're looking at here with our glucometry. So first, obviously you have to put on your gloves. So make sure that you are handling blood. So of course we're going to have our gloves on. So now that I have my gloves on, I want to look at my equipment, make sure I have everything set up. I've got my alcohol swab that I'm now going to tear open, pull the swab out. I'm going to ask which finger does the patient prefer? Said, no, not really the pointer. I'd prefer if I do the ring finger. Said, okay. So I'm going to clean the area on the side of the finger, all around really, but especially on that side of that ring finger where I'm going to be puncturing. Now I pulled out a Band-Aid. Make sure that you do this so that if the patient does happen to bleed quite a bit, you already have your Band-Aid out, ready to go. So once you get your sample, you can immediately apply the Band-Aid. Remember, the garbage from the Band-Aid and the alcohol swab go in the garbage. Now I'm going to take my strip. And remember, you are looking for the gray part of that to go upwards. And you see, I just kind of put it in just to get it going. Now I'm going to pull my lancet out. I'm going to get sure everything's ready to go. The lancet has a spring-loaded needle. I'm going to go on the side of the finger. I've already let the alcohol dry. Just push on it and you can see that a little bit of blood is there. Now I push in the strip all the way to turn the machine on. It's ready for a blood sample. Now she was not bleeding quite a bit, so I had to squeeze a little bit. You notice that we now get a little bit more of the blood. Now I'm going to dip into the blood because remember, the bottom of this strip is where the actual blood is going to get sucked up into. So you see the window right here, that actually has the bottom of it on the bottom side. That's where it actually is sucking up. So I'm going to kind of come in and make sure that that strip goes kind of on top of and kind of in front, as I come into it. So it'll suck all the blood up into that window. Bam. So remember, the strip is already inside the machine, 3, 2, 1, and her blood sugar was 86. So she's not bleeding quite a bit. So now I just want to put my Band-Aid on the patient. Going to wrap it around. Close it off. And now my patient's bleeding is controlled. And now I need to make sure that I get rid of my blood sample and the sharps into a sharps container. And that's the end of the station. I just need to get rid of the garbage that I have accumulated here. This and the Band-Aid, the scraps from the Band-Aid, those will go in the garbage. So the alcohol swab package, and all of the scraps from the Band-Aid will go into the regular trash, and you will see that the patient's blood sugar was 86. We took that sterilely with our alcohol swab. We had our Band-Aid out and ready to go. We put the strip in. Let's see if we can go back to where that was. We put the strip, and we can see that the top side of this is going to be the gray part is going to go in, and the strip is right up there. I can partially put that in, but when I'm ready to take the sample, I'll push it all the way in and that will turn on the machine. So remember, you cannot do this with getting the blood in the strip before you put it in the machine. That will give it an error. It has to be in the machine. Machine has to be on and ready to take a blood sample. That's when you're going to dip it into the finger, and that will pull up the blood and it will give you your reading, which for her was 86.